Hello, welcome back to my show. Today I have a really special guest on that I'm going to be speaking on Zoom. His name is Darren, and I first was introduced to him because of his son, River, and so he was my first patient in the family that I saw, and we'll be sharing what happened with him, the trauma that he went through leading to PTSD. And then what happened also is then I started seeing his father, who I'm talking to, as well as his sister. And so this happens a lot with my office, is once I see one family member, I see others, because then we start recognizing that anxiety runs in families. And so I hope you enjoy this show. Well, hello, Darren. Thank you for joining the show. I really appreciate you coming on. I think I saw your son first. And then I think I've seen 5 members of your family, and that's kind of how it works in my practice. I'll see one person, and then we identify an issue, and then all of a sudden the parents, the siblings, like, you know what, I have that too, or I've struggled with this or that too, and it's so common, and which is why I see families, I see siblings, I see aunts and uncles, I start to see grandparents, and so let's start with, before we talk about your son, let's talk about you. Because I think if I remember right, when you were a kid, you were a teenager, I think you had a seizure, right?
Yes.
And
Yeah,
and tell me about the anxiety. What age do you think you started feeling anxiety? Was it around that time?
yeah. I had one seizure in my life when I was about 15 years old,
Mhm.
and yeah, it was just a really just a frightening experience. And I was completely out when I came back. I sort of didn't know where I was, who I was for a few minutes, and then came to. Never had another seizure ever again.
What
Uh,
did, what did they determine? What did they determine that was caused from?
Well, that question is kind of key because
Right.
they were not able to determine anything. I got CAT scans and EKGs and every sort of test that they could give me, and they were not able to find any sort of cause. They put me on anti-seizure medication just to be safe, but I think it was, looking back with hindsight, I think it was the not having a cause that left a great deal of uncertainty and sort of what's wrong with me and why did this happen? And it was that not having an answer that I think left a lot of anxiety that I could say specifically that's a specific source of worry came from that, because I was definitely very worried about having another seizure because it was such a scary experience. So then pretty soon after, I started developing anxiety symptoms, but at the time I didn't know they were anxiety symptoms. And this was right around the birthplace of the internet. This was the mid 90s or early to mid 90s. You didn't hear terms like panic attacks, panic disorder or anxiety disorder. This just wasn't anywhere near the kind of mental health topic that it is now. So it was that combination of, I there was nowhere to really look up. There was no Google to look up things up. So I would just ask around. I would go, do you ever have this feeling where your hands go numb all of a sudden and get tingly feeling? Or do you ever have a feeling of, I didn't know how to describe things like disassociation because it's such a hard thing to describe, especially when you're a kid. And but people would just look at me like, what are you talking about? And I'd be like, yeah, never mind. And so the anxiety got worse and worse and worse over years because I didn't know what was wrong with me. I thought I was going crazy. It just went on for years. until essentially I went to an emergency room one day because I thought I was dying, which I know can be common for people having anxiety attacks. And I had a calm doctor or calm nurse just sort of have me breathe into a bag and just said, looks like you have anxiety. This is an anxiety attack. And, I think it might have been that doctor somewhere around that time. I was recommended a book called the relaxation response. Was that the one? I don't remember now. But started realizing it was anxiety about that time, and that's when I started sort of tackling it.
Yeah, and it's often a starting point, like you said, the unknown, because you had an EEG, which is an brain scan or brain wave test in a sense, and sometimes we just never know, like in your case, cause sometimes it's easy, like a little kid with a seizure has like 405 fever and that's more obvious, and then some people have them and they have them for a long time, but yeah, sometimes the fear of the unknown is what starts it, and it's very, very common for people to go to the emergency room with anxiety attack, because you're right, because my chest is tight, I might be having a heart attack, I can't breathe, I'm going to stop breathing, and it just people start panicking then the symptoms get worse and worse and worse, and then they end up in the ER, and that a lot of ER visits are that stress related. Now, if I remember right, someone put you on Zoloft. Is that the one that you were initially on?
Yes. Yeah. I essentially, yeah, was on Zoloft for a good while, and that worked. That worked for me for a good while.
When did that stop working, or did it stop working?
Well, it never stopped helping my anxiety per se. It did when the milligrams went up, it really did sort of help overall anxiety. But I think what it was that the the side effects that it came with, I kind of happily lived with them for a while because I was so happy to not have anxiety attacks. So I sort of went, okay, this is like sort of this deal I just have to kind of live with. And I kind of thought that's just life. My life will be, I'm going to have to live with feeling what would happen was because I'm somebody that has a lot of drive, and I, pride myself in being a hard worker, a lot of drive, a lot of ambition, but that medication made me extremely lethargic. So it was this battle that was very difficult because I'm go, go, go. And then I've got this thing dragging me down. So there was most of the side effects had to do with this sort of just that the effects of Zoloft kind of
Right.
slowing me down.
Yeah, and that's common. Hey, it's better. I'd rather have this than the anxiety. But the thing is, the key to tell the audience and explain is that it shouldn't be one thing or the other. It shouldn't be like, well, yeah, but I don't accept side effects with my patients. Especially not. There's minor ones here and there, maybe dry mouth a little bit here and there. But if it's a significant side effect, definitely like fatigue, lack of motivation. Some people get sexual side effects, and so things like that are not really acceptable in my opinion. So now I think I switched you to Prestique, right? And then tell me about the experience switching from Zoloft to Prestique.
Yeah, well, segueing perfectly to meeting you and working with you. Yes, as I said before, I really did think it was, at least for me, this binary situation where it was either life would be with medication and I was just going to have to suffer these side effects, or life without medication, which I also tried that too. I tried going off of Zoloft a few times and it didn't go very well. And so yes, meeting you opened my mind to your approach, which was No, I don't. I want to solve your anxiety, and I don't want you to feel those side effects either. So we're going to work together until we figure that out together. And it was like, wow, I'd never really had a doctor kind of approach it that boldly and confidently. You were very confident about it too, which was nice. And it was like, okay, so yes, Pristique um, was the medication that, yeah, I switched to, which was a scary change because Zoloft was the one,
Right.
it was, it was a
What you needed.
combination of Pristique and Wellbutrin.
Right.
And yeah.
Yeah, and I think the Prestique. Then I added Wellbutrin, and because the Prestique helps with the anxiety, the Wellbutrin helps with the energy and the motivation and the drive. And I think you're on a little bit of Topamax too now too, which is a touch of Topamax, a little baby dose of it,
Yes.
and that can help with a little bit of the rest of the anxiety that is not taken care of with the Prestige. So yeah, you're on a good program here, and I think it's the lesson is really, and I with every one of my patients I say, look, it's not about the number of things you're taking, it's about the results. And like, who cares at the end of the day? And again, the other thing about how long, well, let's not worry about it. It's a chronic problem. It's been happening since your teen years. And it's a combination of genetics. I'm sure it runs. I can't remember the details. I'm sure it runs in your family, probably your parents,
Yeah.
or at least one of your parents. And so, and then hormone changes of puberty, and then a trauma of a seizure. So you had the perfect storm. The perfect storm is all the factors come together, and so, and that's what set things off. And again, I think not that Zoloft's a bad drug. I have some people on Zoloft, but it's typically not as good as Prestige, and it's not as good as adding other things in, because even with Prestige, sometimes people will say it's better than Zoloft, but I'm still not quite as motivated as I'd like to be. I'm still kind of a little bit too tired still, and that's where adding Wellbutrin in. So, yeah, and so you're on the nice, we call it the Corona cocktail. Um, now your son was a really interesting story. Now you had said that he kind of showed signs even before the event. We'll talk about in a second. He was already before that showing some signs of problems or behavioral things going on growing up when he was young. Is that true or?
Yeah, little bits, it wasn't anything, it was just a little bit behaviorally here and there. It wasn't anything that my wife and I couldn't handle. We had checked him out medically multiple times, because he's extremely bright.
Right.
Developmentally, he spoke very, very young. Before he was 2, he was speaking full sentences and knew his ABCs. I mean, he was very, very, very bright, and still to this day,
Right.
always very articulate. And so, yeah, he was always very unique, and definitely had some unique challenges behaviorally, but it was nothing where medication was ever the answer, nothing where therapy was ever the answer. We certainly were on top of it and in communication with his teachers, but he did well in school, he did well socially, and was ultimately, uh, sort of getting along fine.
When was he diagnosed with ADD? How old was he? Was that with me or was that before me?
That was with you.
Okay.
Okay.
That was with you.
Yeah. Yeah.
Yeah, because we had that again, that was there were early signs of like, does he have ADD? And we would get him tested, and it's sort of everything was always kind of on the bubble with him. So it was
Right.
always like, I don't know, he presents pretty atypical.
Yeah.
I don't think so. And it was always kind of that this was all pre-event, and then post-event
Right.
a lot of that changed.
Well, and then there's a lot of misconception because there's a lot of extremely bright kids like him who, you know, they're kind of all over the place. They're a little bit hyperactive. They're kind of, you know, because their brain is just going so, you know, they're fast. And but that's why, you know, ADD medications actually be very calming. They actually calm kids down. But
Right.
you know, the kids who slip through the cracks are the ones who are really bright like him, who are doing well in school academically and don't really. It's the kids that aren't doing so well academically and really getting in everyone else's business and they get in trouble, sent to the principal's office and all that. Those are the kids
Right.
that get to get the attention and get the diagnosis more. So yeah. So talk about what happened at the amusement park.
Yeah, so and I think it's worth noting too the preliminary running up to the amusement park was COVID because he was right at I think just look, I think the COVID lockdowns for any age it was tough and had its challenges, but he was in third grade and again doing well, you know, didn't take to school like duck to water, uh, academically, but was doing fine. And COVID lockdown, he did not do good with homeschooling and didn't do good with the lockdown in general. You know, the things that he enjoyed that were taken away, it got to him. You know, he was a little kid and didn't really understand. It was hard for him to sort of process it, as it was for so many of us. And it was key to note that in his life at this time, roller coasters were his absolute obsession, and he drew them every day and talked about them every day. And Knott's Berry Farm, being it's the local place, he loved Knott's Berry Farm and always wanted to go as much as he can go on the rides, go on the coasters. So during lockdown, it was such his happy place that became the one thing we could do was we would travel to Knott's Berry Farm even though they were locked down, and he would look at the dormant roller coasters and videotape them, and we would look at them and then go back home. So it's key to note all that when everything finally opened up, the night that he first went back to Knott's Berry Farm, I took him there that night, and he couldn't have been any happier. And you know, and mind you, now he's 9 years old, I think 9. Um, and we're standing in line for a ride, and all of a sudden, a mass. I had never been in a true mass panic situation before. And here one just, it went from 0 to 60. I mean, it went from we are standing in line and we're having, it's father, son, we're on top of the world, to hundreds and hundreds of people charging at top speed, screaming at the top of their lungs and saying, he has a gun, somebody has a gun. And in this day and age, it's like, what does that mean, right? It's like somebody have a gun and going through the park and mowing people down. I mean, God knows what that means this day and age. And so, but regardless of that, there was also just the physical threat of now hundreds and hundreds of people just running at breakneck speed in all directions. So I literally picked him up. He has no idea what's going on. So he just starts screaming at the top of his lungs. His shoes fly off. And I run top speed from where I was in the park all the way to the car. And so it felt like 10 miles. It was probably, God knows, a mile or more. And in that entire time, we're running with hundreds or so people. He is screaming the whole time, wondering what's going on. So that event and what did happen that night was there was a drive-by shooting where somebody pulled up to the front of Knott's Berry Farm, shot 2 kids, but they pointed the guns at the park. And those two kids lived. They didn't die, but those two gunshots sparked off the panic inside the park. We were near where those gunshots were, so we were sort of near the epicenter of where everybody was really panicking. So very close to right after that event, days within days. And I'm someone that lifetime of living with anxiety disorder, helping other people, coaching other people, just from a layman standpoint of really coaching them to go get help and giving them layman education on it. I know a thing or two about anxiety disorder, and I can tell you it was the most striking acute case that just overnight he went from a kid who was fearless. I mean, a kid who would get on an airplane, fly across the country without his parents. He did that. He would go on any roller coaster, even though he was small. He would go on, it's the scariest coaster he could get on. He was a fearless kid and the most social kid you can imagine. He was like a little Ferris Bueller at his school. And he, overnight went from that to he could not be left alone for 1 minute. He could not go anywhere in public. If my wife and I tried to walk our dog and leave the house, he would start shaking and crying. And it wasn't just, when I say can't, meaning please don't. It was a visible, very striking. I mean, the shakes, him getting physically ill, throwing up, just absolute panic like I've never seen. This went on for the better part of 2 long years, and it was a long road back.
It was when I saw him, was he on Zoloft also? I think he was on Zoloft.
I think he was on Zoloft when you met him. Yeah, he was in therapy. We had him in therapy basically every week. A fantastic therapist that we had met that specializes in PTSD.
And the EMDR, did you do EMDR therapy?
They did EMDR therapy, and it got him through a lot. He was basically, he was able to slowly get back to normalcy as far as facing a lot of things, getting back into a roller coaster again, and overcoming a lot of fears. But what it did, unfortunately, timing wise, it coincided. This was the horrible part of it, was that the world opened back up. He went back to school as he is riddled with the worst case I've ever encountered, I've ever seen personally, of anxiety disorder. So what this resulted in was a kid who was once very socially dialed. He was having crying fits, panic attacks every day in front of his classmates, in class, on the schoolyard. It was just uncontrollable. We were getting phone calls daily. Then that turned into 3 or 4 days a week. Then that turned into twice a week. Then once a week. I mean, it was a long road out. And everything from bullying started up around that time to, I mean, it's just been, it's been a long road. We're still navigating our way out of it. The anxiety is under control in a great way, very much thanks to the therapy, very much thanks to you and him being on the right medication, but he's still on the road.
And he's on, I know he's on Prestige now, and he's been able to go back to amusement parks, like you said, right? He's been able to go back on rides again, and
he's been able to go back on amusement parks, go back on rides. He's an incredibly talented musician, and he is he was able to get back on stage and perform in front of hundreds of people. And so he's
What's his instrument?
drums and guitar, both. Yeah.
Yeah, and the school well, anyone who's heard my podcast knows my opinions about the pandemic and the response, and the school shutdowns were absolutely ridiculous. Never should have happened. They caused so much harm to kids to this day, even that's not going to be never going to be undone. I mean, but now we can look back and say, okay, it never was a risk to kids. There was no teachers or kids in the world that died of COVID, not one case, and there was the schools were open in a lot of places, and so anyway, but I won't go on about that.
Yeah, well, we definitely experienced, and just like anything else, certain things work differently for different people, and we have other kids, they did okay. For River, the recipe was just horrible. It was just horrible for him. And yes, we're still on a very difficult path navigating our way out of it.
Well, someone like him who's really bright, he'll catch up. But there's a lot of kids who maybe don't have quite his intellect, who will never catch up. You lose 2 years of school, and it's hard to catch up after that. You can't just
Yes.
So, and now but he's doing a lot better, and I know, and then I've seen, I think your wife, your sister, your daughter, and so we're identifying that, that these things run in families, and there's a genetic factor, and my voice, so what? I mean, the fact that we identified these things, the good thing is at least the stuff is treatable, and
Absolutely.
And Prestique is my favorite medication to prescribe because it's my overall number one for a reason, because I think the tolerance, the positive effects, lack of side effects for the most part. So yeah,
Yeah, there is still definitely the stigma is still out there, because I've lived with anxiety disorder so long, and having a child and children go through it. I'm very my radar is always sort of out there for anybody in my life where I spot that they may be going through it. And I always just try to gently offer advice. And that's why you end up with a lot of referrals. You've ended up with quite a few referrals from me. I have a close friend who I just spoke with recently, who he opened up to me about some issues he was dealing with. And in a matter of seconds, I was able to go, buddy, it sounds like you've got major anxiety disorder. And it sounded like he'd had it a long time. And he told me he had never treated it with any medication, and he's scared to. And, I gave him your name. I told him my story. Yeah, I used to have the same stigma. I mean, for years, even when I discovered what I had, and it was very much in pop culture. I was watching a movie the other day, and it made me laugh. It was in movies, and I was watching a movie where, a husband discovers that his wife has Zoloft, and it's in her cabinet, and he looks and he's like, oh my god, and the music's dramatic, and this was the 90s, and I went, wow, it's so funny. It was so stigmatized back then. It's so much more common now, but there is still people that I think are very scared or resistant. And I think everybody has a different experience, and certainly I think you should try it if you've got methods that are working, and you're able to function and get through it. Great. If I was able to do that with just meditation and just meditation and exercise and self-talk and therapy and things like that, great. But the reality for me that I had to face was my wiring got messed up as a kid, and this medication helps my wiring get just kind of an even playing field, and I just sort of feel normal. I just normal again, and you definitely helped kind of clarify that for me and think simply about it.
Well, the stigma is huge, and it's especially among men. Men have the most difficult time because we don't want to display signs of weakness or feel like we're, and women are much more accepting typically of treatment. And what you said right there is really important. Normal, so because people think, well, I want to be normal. Normal means off medications. Well, do we say that about a diabetic who needs insulin? Oh, you're not normal because you're on insulin. Well, no, I believe I'm normal. I just have diabetes. So normal is what medications do. They normalize the flow of your neurochemicals, and that's when people say, I just feel like myself again. I feel like it's the old me back. And that's exactly what it's about, and that's exactly what I look for. And with every patient I see, I don't rest until I hear the patient tell me that. And if they're not telling me that, I'd like, okay, what else can we do to get you there? So
yeah. I love that.
Well, thank you so much for coming on. I really appreciate it. I think the audience has really learned a lot. Hopefully about your story is it's inspiring, and the fact that that you helped your son, and you and your wife are amazing people and great parents, and you have a great family, and I think 4 kids, right?
So. Kids, yeah.
God bless you.
Busy, yes, always busy, never a dull moment.
Yep, exactly. Well, thanks so much, Darren. I appreciate you coming on.
Thank you, Dr. Cron. You're the best. Thank you.
Right.